talking to cluster outbreaks and what it means for different areas and the impact thereof. So, Dr. Yogan Pillay, again, Deputy Director General at the Department of Health, thanks for your time. So, you began by explaining what cluster outbreaks are and how this is affecting South Africa. So, apart from being the epicenter, the Western Cape is recording many cluster outbreaks as well, especially at supermarkets. How should they be dealing with a situation like this?
So that's what we found, Leanne, that in the Western Cape and in parts of the Eastern Cape, we've been able to identify areas where people congregate. And again, it's not very surprising that in any congregate setting, whether it's a supermarket, whether it's a factory, whether it's a prison, whether it's a hospital, where people congregate, where there's lots of people, you will get, if there's one person who's positive, that person is likely to transmit the virus to a large number of others in a very short time. You know, you have to stand about 1.5 meters before someone, in front of someone, and speak to them for about 15 minutes to get transmission happening. So it happens in a very short period. And of course, as we know, the virus also settles on surfaces, especially steel and plastic surfaces, and can last there for 72 hours. So what we are saying is that we need to be ultra careful in any area that has lots of people in it. People congregating, people shopping, again, in train stations when the trains open, in buses, when buses start running again. And the same is true of taxis. So we are asking shop owners, including the retail shop owners, the mall owners, etc., to be ultra cautious, to ensure that people sanitize their hands as they go in, preferably as well as they leave the premises, to sanitize their hands. We are asking people to use masks at all times. And these very small but important measures can prevent the transmission of this virus.
I mean, we talk to, obviously, a lot of worry among South Africans now. I know there's two factions at the moment, or two groupings, and everyone has an opinion. Open up South Africa and let us get back to normal and deal with it with these measures that you're talking to, wear masks, social distance, etc., so we can get the economy going. But there's also a school of thought that is saying, I am petrified to let things go back to normal, because as much as I'd like to social distance, or I'd like to ensure that I've got all of these measures in place, not everybody is going to abide by them, and the risk of me getting coronavirus is growing, and it's a great worry. So as the conversations keep going and government talks to going to level 3, are we going to see, is it inevitable that these cluster outbreaks are going to happen and we're going to see more South Africans, unfortunately, getting coronavirus?
I think the first thing is prevention, of course. And the president already mentioned the other night that we must focus on the toolbox of prevention. And I think that's fairly clear. But it's also true, Leanne, that we will get these outbreaks. There will be transmission because we can't prevent it 100%. The good news is that, 80% of us who get it will have very mild symptoms, will not even have to see a doctor. The other 20%, of course, unfortunately, will have some symptoms that will require hospitalization of one kind or another. So the first thing, of course, is prevention. The second is early detection, so that people then can take good care of themselves and not transmit the virus to others. And then the third is that if people have the symptoms, they must seek attention, seek care, seek healthcare providers as quickly as possible. So I think those are the three phases that I would like to emphasize. Prevention, early detection, and seek care if you have the symptoms.
Okay, so those are the things that we must look to. I want to get back to the Western Cape scenario, because there's been so much talk as well about the Western Cape and the high statistics that we're seeing coming through. I mean, they have a very high caseload of those that are infected. The death rate is also much higher in the Western Cape. But when we look at the bigger picture, we obviously don't have the accurate statistics at this point in time to see the testing, to see which province is testing the most, and if that actually balances out with the numbers. So perhaps you can give us some more clarity over there. The testing versus the outbreaks, in particular focus to the Western Cape. What's your view on that?
So we've had a number of conversations with our colleagues in the Western Cape and what we've called deep dives with them. And clearly they're doing the right things. They're testing in the right areas. They are looking for clusters. And once they find an infection or a person who's infected, they are testing all of the contacts rather rapidly, especially in what we've called congregate settings like supermarkets. The other thing that's obvious about the Western Cape, if you look at where the clusters are, you will see that they are clustering around fairly dense areas, and they are now in the townships, which means that there is community transmission.
Yeah.
You know, the first phase, the first 4 weeks in the Western Cape was what we call imported cases, which are people who are returning from countries at higher risk than us, largely Europe and the US. But the last 4 or 5 weeks have been characterized by local transmission. So typically what happens is that people who are working in supermarkets or in factories and live in the townships get infected in places outside the township and then travel back to their homes. And that's how the infection spreads both within their families and in the surrounding community. And you can see it if you look at the heat maps that the Western Cape officials have produced, how the transmission has happened, whether it's in the Tygerberg area, or whether it's in the Khayelitsha area, or whether it is in the Hout Bay area. And again, we found the similar in the Witzenberg area in the town of Ceres. So the pattern is very typical. And what the Western Cape has done is that it's taught us a good few lessons about what to look for in other parts of the country. And we are seeing similar now in Chris Hani district, in the Eastern Cape, as well as Buffalo City and Nelson Mandela Bay. So we will be looking for those now in areas in KwaZulu-Natal as well as in Gauteng. And in KwaZulu-Natal, we've already found it in the Ilembe district around Ballito Bay, where the supermarkets around there have been nodes of. So we now know what to look for in terms of these clusters, based on the experiences we've had over the last 70-odd days.
Yeah, and also experience, Doctor. This will be my final questions. Obviously, time is running out. But when we talk now, and I'd like to talk to children and schools opening specifically, because this is the thing on top of most people's minds. Are schools going to go back or not? And then will this result in massive cluster outbreaks? Because this is, again, a lot of people together in one concentrated area, and to try and keep masks on kids is a very difficult thing. I mean, we've also seen in the United States, they're now discussing something that may be problematic to children and teenagers as well. Apparently, this very rare Kawasaki disease as a possible association to COVID-19. What does this mean? I mean, does this mean that we will begin to pay more attention to actually testing children?
So it's quite complex, and it's getting more complex, Leanne, as you correctly point out, because we are learning more and more about the disease and how it affects different parts of the population in terms of ages as well as genders. And the recent information from the US, the numbers are still small. In the US, they only diagnosed the syndrome in about 120 children and young people, as it turns out. So it's very new. They are asking clinicians to be on the lookout for symptoms in children. That includes fever, as well as a few other symptoms that affect various organs of the body. And we will be watching this rather carefully. But in general terms, and what we've seen throughout the world, is that children do get infected. There's no question about that. But they have very, very mild symptoms. And very few children need hospitalization, and there are very, very few deaths in children. So they have very mild cases. What we are concerned about in communities where children are looked after, are cared for by the elderly and older people, especially those over 60, 65, the older people then that are taking care of these children might be at risk when children come back if they are infected. So we need to kind of worry about not only the children being infected, but the fact that they might be minor spreaders, not super spreaders, minor spreaders of the transmission of the virus to older folk.
All right, we have to leave it there. Dr. Yogan Pillay, thank you for talking to us. He, of course, is the Director General at the National Health Department, giving us an idea of what a cluster outbreak of the coronavirus is and other issues as well that are related to this.